Hello. As he said, my name is Donald Jones, and I'm working in support of the military health system. And I'm going to talk to you a little bit today about the integration of social media channels that we use to connect with our stakeholders. Just to get you up to speed, the MHS is a system of systems, which includes TRICARE, the Surgeon Generals of the services, and other components. The Strategic Communications Office of the MHS provides guidance on outreach and media for the MHS, and the social media is part of that effort. Now, why we're doing this, 59% of people in a survey in 2008 said that they look to the internet for information before they look to their doctors. So we think it's important to provide timely and accurate military health information to our beneficiaries. And we realize that there are conversations going online, and if we're not part of those conversations, somebody else will tell our story. The most important thing is that our primary stakeholders are 18 to 24-year-olds. They're digital natives. They live on the internet. They get their information through their social networks. So we need to go to where they are to provide them the best information possible. Our social media endeavors are integrated into a larger outreach scheme. It's a piece of the puzzle. Our toolbox includes monitoring. It includes our podcasts, social networks, a lot of different tools that we use to provide the best outreach possible. It centers around our health themes that we have every month. For example, August was Eye Health Month. We provide a landing page on health.mil, which we collect content, and then we distribute and publicize around that content onto our social networks. All of our engagement is defined by our social media engagement protocol. It provides us with information about how to engage, who to engage with, what to respond to. This provides us compliance with our privacy and security policies. For our leadership, we provide a blog pulse check. We use RSS feeds to monitor the military health conversations going on online. Then we distill this for leadership so that they are in touch with public sentiment and hot topics. Our MHS blog provides our stakeholders with a way to dialogue with us. We provide healthy debates, which are an opportunity to have discussions around contentious topics like smoking in the military or emergency contraception. We also have a .mil Docs podcast by which we can feature MHS experts and heroes. We use integrated social media channels. All the third-party popular social media channels were there. We also connect with our component organizations within the MHS through those channels. So TRICARE's Twitter is connected to ours, and we share information that way. For example, on our Twitter account, a woman in Texas who's a military spouse Twittered us looking for resources for autism. Within a couple hours, we were able to connect to her to the people on her nearest base that would provide her with the resources she needed. In turn, she wrote a blog for us. On Facebook, we provide all of our content, our videos, our photos, our tips and news, and the great thing about that is that it has exponential outreach because then that is repeated on our fans' walls. We used Flickr to solve a technological problem. We didn't have the resources to make e-cards on our own site, so we used Flickr to post those and allow people to send them. We had over 450 people send our Father's Day Men's Health e-cards to their loved ones. We also use YouTube to repost content from our health.mil media room. One thing you can notice about all our channels is that we brand consistently, and we also put all of our messages out through all of them so that we provide an authentic voice. Internally, we have the Social Media Roadshow. What we do is we connect with our component organizations within the MHS and share best practices about how to use social media and how we can collaborate. This has increased our collaboration within the MHS. Our social media hub is a one-stop shop to find social media accounts for all the MHS components. You can also find their widgets that we've created that you can embed on your website and get the latest news and information about the MHS. We've had a lot of success. Our information has been reposted on blogs and military websites. We've doubled our traffic to health.mil, And we've provided increased information sharing among our partners, and we've also humanized the MHS. Thanks a lot.